Welcome to this essential guide on understanding and managing Sheehan syndrome. As a woman or a healthcare professional, it's crucial to be informed about Sheehan syndrome. Today we will explore the definition, etiology, risk factors, clinical features, differential diagnosis, investigations, complications and management of Sheehan syndrome. Sheehan syndrome, complication of severe postpartum hemorrhage (PPH) and hypovolemic shock, leading to ischemic necrosis of the anterior pituitary gland. Extremely rare, seen in around 500,000 births. The pituitary gland is located within a depression of the sphenoid bone called the pituitary hypophyseal fossa or sella turcica. The blood supply to the anterior pituitary gland is from the hypothalamo-hypophyseal portal system, which is a low-pressure system. This means that it is vulnerable to rapid blood pressure reductions. In contrast, the posterior pituitary gland has a rich blood supply from various arteries, so it is not susceptible to ischemia during drops in blood pressure. The hormones that the anterior pituitary releases are follicle-stimulating hormone (FSH), luteinizing hormone (LH), thyroid-stimulating hormone (TSH), growth hormone (GH), adrenocorticotropic hormone (ACTH), prolactin. The hormones that the posterior pituitary gland releases, which are typically not affected by Sheehan syndrome, are antidiuretic hormone (ADH), oxytocin. Risk factors for Sheehan syndrome include pregnancy, particularly multiple pregnancy, placental abruption, placenta previa, preeclampsia, severe PPH, history of autoimmune disease. The clinical features seen in Sheehan syndrome are associated with the lack of hormone production by the anterior pituitary gland. Patients can present acutely or chronically. Commonly, women present months to years after the initial event. Clinical features of Sheehan syndrome include reduced milk production, agalacturia, due to the lack of prolactin, amenorrhea, due to lack of FSH and LH, hypothyroidism, due to lack of TSH, adrenal insufficiency and adrenal crisis, due to lack of ACTH. The first and most common symptom of Sheehan syndrome is agalacturia, and another common symptom is amenorrhea. Symptoms typically reflect which anterior pituitary hormones are affected and to what degree. These symptoms would relate to deficiencies of thyroid hormones, prolactin, gonadotrophins, adrenals, and growth hormone. Symptoms of hypothyroidism include fatigue, weight gain, constipation, depression, loss of libido, cold intolerance. Symptoms of adrenal insufficiency include fatigue, muscle cramps and weakness, thirst and craving salt, dizziness and fainting, abdominal pain. Clinical findings of hypothyroidism on examination include bradycardia, dry skin, stiff muscles, cold peripheries, hair loss. Clinical signs of adrenal insufficiency include hypotension, particularly postural hypertension, bronze pigmentation of the skin, commonly in skin creases. Other signs on clinical examination may include breast tissue atrophy, decreased axillary and pubic hair growth. Differential diagnoses of Sheehan syndrome include Addison's disease. Patients will present with adrenal insufficiency alone. Pituitary tumor. Patients will present very similar to those with Sheehan syndrome. Hypothyroidism. Patients will present with symptoms of hypothyroidism alone. Menopause. Patients will present with amenorrhea alone. Relevant laboratory investigations include blood tests for the hormones produced by the anterior pituitary, TFTs, FSH, LH, ACTH, prolactin, plasma cortisol level, serum IGF-1, low in hypothyroidism and GH deficiency, GH provocation test. GH level is measured after clonidine and arginine are administered, which stimulates GH secretion. Pituitary hormone stimulation tests, metoclopramide and clomiphene citrate stimulation tests. Relevant imaging investigations include MRI scan, may show acute changes of ischemia or an empty sella turcica, also to rule out other causes of the symptoms, e.g. a pituitary tumor. CT scan, if the MRI scan is inconclusive. Management of Sheehan syndrome will be guided by a specialist endocrinologist, and it will be lifelong. The main aim is to replace the missing hormones, HRT, including estrogen and progesterone for female sex hormones until menopause, growth hormone, levothyroxine for hypothyroidism, hydrocortisone for adrenal insufficiency. Complications of Sheehan syndrome include hypothyroidism, Addisonian crisis, death. Thank you for joining us in this educational journey on understanding Sheehan syndrome. Stay informed and take proactive steps to safeguard your health.